Good afternoon, everyone. Just a quick plug from the programming committee. One of the things that we've tried to do recently in order to maximize the time that our speakers have to speak with us and the time that we have to ask questions is to include a biographical slide which plays during the slideshow while we're all getting lunch, but also prior to the speech, as now. So initially, there was some confusion about the title of today's program. The title we originally had was Working with the Dead. But that is not what Emma does, nor is it how she sees her work. Sure, determining manner and cause of death is a necessary part of the job of any coroner. And there are cases that use cutting-edge forensic science to help solve crimes. But the majority of Emma's work involves death by natural causes. Working with the Dead was the wrong title because Emma works primarily with the living, providing support, compassion, and answers when possible to grieving families and friends struggling to come to terms with the loss of loved ones. Today, we are fortunate to have a smart, kind, and caring Boulder County native as our speaker. Please welcome Boulder County Coroner Emma Hall.
Good afternoon, and thank you for having me here today. I always appreciate getting an opportunity to come out and speak to an audience about what the coroner's office does, because it really is something that is misunderstood. It's misrepresentative in our media and especially our crime shows on TV that everyone loves to watch. And so I always appreciate that opportunity to come out and talk to you about how the office actually works, because this is really an area in our culture that we don't talk a lot about. We don't want to talk about death within our families and plan for the final chapter really of our lives. So I think it's really important when people arrive at that situation that they are working with our office, that they have a little bit of background and a little bit of foundation as to how our office functions. I'm going to try to adjust a little bit here so I can see the screen. So a lot of people may or may not know that the coroner is elected, and I'm going to talk a little bit more about our coroner system here in another slide. I have been the Boulder County Coroner since January 11th, 2011, so this is my 9th year in office. My background, I have a degree in criminalistics, which is the study of evidence. I went to Metro State College in Denver. I basically knew what I wanted to do since I was a little girl. I grew up in Hall Ranch in Lyons, and in 1981 there was a woman who was kidnapped from Longmont and taken up above Lyons and brutally beaten in an outhouse, and that was where she was discovered. And as a child, I just had so many questions about what happened, but the most important thing to me was I wanted to make sure that the family's questions were answered, and ultimately that justice was served. And so that was really how I got my original interest in this office. As I continued to grow up, there were other events in my life that happened that added to that interest. And especially, I just really loved the medical side of things and human anatomy, but yet the investigative side of things. So really, when you bring the medical and the forensic piece to get those components together, the coroner's office was really the best fit for me as what I wanted to do. So because I am a Boulder County native, my family's been in Boulder County since 1872. It's just a huge honor for me to be able to serve my own community in this way. So I kind of mentioned this, that we just don't like to talk about death in our culture. And there are some disadvantages to that. There's just a lack of understanding of how our coroner system works here in Colorado. and a lack of preparing their surviving family members when one person in your family does pass. A lot of times the surviving family, they don't know your desires, and so then they're trying to make the best decisions they can, not knowing your wishes, and it just is a very overwhelming time. And it may add to the grief process. So I always like to give a plug that there are resources out there, kind of a nationwide movement. There's been something come up that's called death cafes. And there's also conversations on death, which is usually through hospice agencies. Mortuaries are another great resource, and the coroner's office is also a great resource for opportunities like today where I get to come out and speak. But we also do quarterly tours of our facility, and I'm going to talk about that again in another slide. So I do have a lot of information to cover in a short time, so we may not get through everything I would like to cover today, and I know a lot of you are going to have a lot of questions as well, so we'll get through as much as we can. So just briefly, the difference between a medical examiner and a coroner's office. Like I mentioned, Colorado is a coroner state, so we elect our coroner by county. Whereas some of our other states use a medical examiner system where they appoint a director, which is usually a medical doctor, usually a forensic pathologist. And then that medical examiner's office, they may have regional offices throughout the state, or it may just have one office for the state. Whereas in the coroner system in Colorado, we have one coroner per county. So the coroner still relies on the forensic pathologists because they are the ones who do the autopsies for us, but the coroner is the one who is actually running the office. So really, the purpose of the coroner's office is to determine the manner and cause of death. So the manner of death, we have 5 categories that we choose from: natural, accident, suicide, homicide, and undetermined. And then the cause of death, so that would be more like the mechanism or the disease attributed to the death. So a natural death the cause of death may be esophageal cancer, and so on and so forth for each of the manners of death. Another purpose of the coroner's office is we are a service to society. We do investigate deaths, but we're also really kind of providing a voice for the deceased and assistance to the living and the family. We provide assistance for insurance settlements and civil litigations, and then of course we're also providing assistance with law enforcement. And that's always a question, is what's the difference between the law enforcement and the coroner's office, or how do we work together, or how does that happen? So really the easiest way to think about it is that law enforcement, when they come out, they have jurisdiction over a scene. And they need to make the scene safe. They can't call us out and have us go in and investigate a death if they haven't cleared the scene and made that scene safe yet for us. And then they are investigating if a crime occurred. So at the same time, we have jurisdiction over the body, so they're going to request the coroner's office to come out if they have a death at one of their scenes. But we have jurisdiction over the body, whereas they have the jurisdiction over the scene. So we do have to work together because those two things are connected, but yet we are doing a completely separate investigation. They're investigating a crime, and we're investigating to determine the manner and cause of death. And a lot of times people don't know, but there is a Colorado statute that says the coroner is a peace officer while engaged in the performance of his or her duties. So the responsibilities of the coroner's office. So in addition to investigating the death, it is the coroner's role to determine identification. And positive identification simply means more of a scientific. So in our office, we always try to do scientific. 95% probably of our identifications come from fingerprints. We are lucky in Colorado in that when you go get your driver's license or your Colorado identification card, you submit your right index print, and we are able to get that print and compare that. So that's how we identify most of our people. And most of our people come to us, we have a really good idea of who we think we're dealing with, but we still like to have that scientific identification to go with it. It's also our responsibility to notify the next of kin. We sign out the death certificate. And then really the biggest thing for me is answering the questions for the families, but yet working on behalf of the decedent. We do give out public information and media releases. We try to minimize that as much as possible because I do believe that the families have some rights to privacy, but there are certain things that are considered public record. So autopsy reports are one of those things that are public documents. We will release the ID once the identification has been confirmed and the next of kin has been notified if we have a request for that information. So just to kind of give you an idea, I think a lot of people don't really realize how big Boulder County is. So this is a list of all the cities, towns, and unincorporated areas of Boulder County that we work with. While most of our population is right around, the Front Range, Boulder, Longmont, Louisville, Lafayette, that area, we still have a lot of mountain, rural areas that we need to get to, and we have to cover this entire area 24/7, 365. So in order to do that, here's my staff. So there's the coroner, which is me. I do have a chief deputy who's in the picture to my left up there. His name's Dustin Bueno. We've actually been working together since I started my career. So we've been working together over 10 years, and he's a great partner to have. He really helps me run the entire office. He's kind of in charge of the investigations department, the pathology department, and then the administrative department. We have 2 forensic pathologists that are contracted with our office, so we don't have any full-time docs, but we have a couple who rotate in. There is a nationwide shortage of forensic pathologists, so I feel pretty lucky to have the coverage that we do in Colorado. We do have to share our docs with several other counties, but at the end of the day, we work it out and we get all the cases taken care of. And then I did start an internship when I came to Boulder County. I felt fortunate enough to get an internship when I started my career in Adams County. This field is kind of hard to get into because they usually want you to have experience, and it's hard to get experience if you don't have an internship type of opportunity. So that's something I've started in Boulder County, and it's been very successful, not only for the students, but for our office as well, to give us more hands-on help. So then people want to know, well, what's my role? So really, it's my job to manage the entire office. So on the admin side, I'm working with the personnel and the budget. On the cases, we're working with investigations, autopsies, manner and cause of death. I do have to meet criteria set by the Colorado Coroner's Standards and Training Board. And then one of my biggest roles is relationships and resources. So I try to expand my relationships with my partner agencies in our local Boulder County area, but also on a statewide and a nationwide level. And the more you network, the more resources you find out about, the more grants you find out about, the more standards, more training. It just opens up a whole world of opportunities for our office. So this is to talk about the medical legal death investigation side of the office. So this is what the Colorado Coroner Statute covers as all the cases that we have to, that falls under the coroner's jurisdiction. And it's easier to tell you which cases don't follow under our jurisdiction, which would be any death that is attended by a physician. So that would include a lot of hospital deaths. That is, if they've been there more than 24 hours and they are dying of a natural disease process, which also includes a lot of nursing home deaths. So the ones that don't fall under those are the ones that we take care of, and this gives you a list here to give you a little bit of an example: external violence, unexplained cause, or under suspicious circumstances. Physician is in attendance but is unable to certify the cause of death for various reasons: thermal, chemical, or radiation injury, criminal abortion, disease which may be hazardous or contagious and basically a public threat, anybody that dies in the custody of law enforcement, when the death was sudden and happened to a person who is in good health, and any industrial accidents. So this is to kind of give you a behind-the-scenes look of what does that mean? What are we actually doing? So I have a couple pictures up here. The picture of the stack of medical records. We go through countless medical records. Now, this day and age, they're coming more electronic to us, which is great, but that doesn't reduce the amount of information we have to go through. It is pretty substantial. And a lot of our cases, 85% of our cases are natural cases, so that's what we're relying on to do our investigation a lot of times is the medical records. I put the picture of death scenes up here because it's interesting to me how when I look back in history, this book is basically a photo collage of, it's a homicide detective scrapbook. When I look at those photos and I look at modern day photos, they're really not any different. You know, the clothing may be different, you know, the vintage cars in the background may be different, but it's basically, you know, we die the same way over and over again. So throughout the years, even though our process has changed and our documentation of evidence has changed, basically what they were seeing, you know, 60 years ago, we're still seeing today. So it's just interesting to me to see that similarities. And then we have a picture of a grieving family, because that's really the most important piece of all this, is working with the families. So death scenes investigation. So we go out to a lot of scenes, homes, traffic accidents. We do go to hospital cases. A lot of times that's because maybe somebody was in a car accident or in a recreational type injury, or even maybe a homicide or a suicide attempt. Basically what happens is a lot of times if someone dies at home or in a car accident, someone's going to call 911. So the chain of command is, it gets reported to the dispatch center. They call out their first responders, so fire, EMS, police. Once they get there and they make a death determination at the scene, then the coroner's office is called. And as we talked about, then it would be our job to come in and make sure the identification is done and that the family is notified, and then we're going to work with law enforcement and the victims' advocates for that notification. We're going to work with them to do the scene documentation and to document the body and surroundings as well. And then it would be our job to assume custody of the body and preserve any effects, medications, personal items, that type of thing. So I like to let our community know that we have unmarked vehicles. I think that's important. I've worked in other jurisdictions where they had marked vehicles, and for me, I feel like it adds a little bit of privacy. I mean, the red, white, and blues are already out there in front of the home, and the neighbors are already peeking out the window wondering what's going on. So when the coroner's rig shows up, it's kind of a big indicator as to what's going on. So I don't like to have that kind of advertising, so that's why we use unmarked. So this is just kind of an example. I always like to point out that we take the medications that are prescribed to the person who has died, because that's part of our investigation. It gives us a lot of information. The doctor, who's prescribing, what they're prescribing, how much they're prescribing, and then how much this person was either overtaking, undertaking, or keeping right, where they needed to be with their meds. But that looks like a lot of meds. That's pretty typical for us. So there are a lot of hours spent on medications. So just talking a little bit more about the investigation. So we do collect fire reports, EMS reports, police reports. Like I talked about the medical records, we inventory those medications, and then we conduct interviews of family members, witnesses, medical care, maybe the nurse, maybe the doctor. We determine if an autopsy is needed. And then we sign out the death certificate, which is provided to us by the mortuary. And then we would release the body to the mortuary. And then if we do an autopsy, then we would be releasing the autopsy report. So all of this process takes about 6 to 8 weeks if there's an autopsy involved because of the report. But the body doesn't get held up for that long. We're usually able to release within 24 to 48 hours, just depends on how quickly we're able to do the autopsy. So this is the pathology side of things. So this is usually a lot of where the questions come from. People want to know why we're doing an autopsy or how many autopsies we're doing. We have about 2,000 2,000 cases in Boulder County every year, and we do about 250 autopsies. So not everyone gets an autopsy. They are basically ones that we need to document for forensic or medical evidence, or we just don't even, know from the onset what we think the cause of death may be. Sometimes we have kind of a guess, well, maybe this could be a medication overdose, but it very well could be from natural causes. So we're going to do that autopsy to determine which way. And then sometimes people will say, well, it's a gunshot homicide, why would you need to do an autopsy? Well, yes, we may know that it's a gunshot wound, but we need to collect the evidence and help the DA's office out because they're going to have to prosecute. So the angle of trajectory becomes important. If there's more than one wound, that becomes important. If there's defensive marks on the body, that becomes important. So there's a whole lot more that goes to than just the cause and manner. It's the collection of evidence as well. And then we also do toxicology. Histology is where we collect pieces from each organ, basically, and then we're looking at that at the microscopic level. Microbiology would be looking for, we would basically work with the hospital is usually who we go to for that, so that then we're looking for any disease mechanisms. Collection of evidence. So any of the evidence that we're collecting, we're going to be releasing to law enforcement because, like I said, we're determining manner and cause. If there is a crime, then they're the ones that are going to be collecting that evidence and processing that and utilizing that in their investigation, and then the DA's office for the prosecution. Like I said, autopsy results are about 6 to 8 weeks. Could be longer with high-profile cases. Donation, a lot of people ask me about how donation works. So in Colorado, we have donor registry and also next of kin authorizations. So we work with the organ procurement organization. They are the ones that will determine eligibility. And then once they make that determination, we will work with them. There is a lot that goes into lining up donation. First and foremost, there's very strict timelines. So a lot of times, by the time the person is found deceased, we may have already gone past that time frame, and so they wouldn't be able to include that person on their eligibility list. So if they are found quick enough, then we're all working together as fast as we can to try to work within that window. And then also we have to weigh the forensic and medical evidence against, if there's something that they are eligible for, but it's something that is going to change our outcome on manner and cause of death, then we would have to work together to decide which is going to take precedence. So the death certificate, we do sign them. They are filed, though, by the mortuary, so we sign them, but we're not the ones that actually file them. So we are a piece of the process, but not the final. It's probably been maybe 3-4 years ago that Colorado went to the electronic death certification system, which has been great. We used to have to do these all on paper like you see in this example, but now it's all on a computer, which has really helped reduce the amount of staffing hours that it takes to complete one of these. So really the biggest thing, again, to me is answering the questions for the family. So at the end of the day, that's when we can feel like if we did our job and did it well, is if we can answer the family's questions. But we also have to know that there are some questions we just can't answer. And that's always, I would say, the toughest part of our job. A lot of people ask me that, what's the toughest part? And I would say that, when you really want to answer a question for a family and you can't. So just to give you some quick statistics, this is the manner of death by number and percentage in Boulder County in 2018. Like I said earlier, there's about 85% nationwide is natural deaths, and I think we were about 86% in 2018, so right at that 85%. Our next highest level is suicide. We had 64 in 2018, which is about 3.5%. We have those are accidents, but we break them out because we feel like that's kind of a separate category of accidents, just because I think we always want to know how many traffic accidents are we having. So we have traffics was 27, others was 140. A lot of those others are elderly people who fall and break a hip. And then we are investigating that to determine, did this person die quicker because of that injury? And now this is an accidental versus a natural death. So that's what a lot of those are, and that's why that's so high. Homicide was 7, undetermined 7, and NA, fetal demise. On fetal demises, we do not have a category for manner of death. So those are an NA, and they're not all reported to us. A lot of times the ones that are reported to us are the nurse just isn't quite sure if she should report or not, so those get reported to us. Occasionally we will have a fetal demise that we have to investigate further if there was trauma or drugs or something like that involved. So just real quick, violent death reporting. This is something that the state does, and then they play into a much bigger nationwide system. But basically they are coming to us and saying we want more information on suicides, homicides, unintentional firearms, legal intervention, and undetermined deaths that may be violent in nature. So in the bigger system, there's 42 states and territories that supply data into this. And from there, basically this data is used to help the public health officials, violence prevention groups, policymakers, law enforcement, community stakeholders, and others to figure out prevention plans. And so the data can be found in multiple forms. If you go to their website, they have the Colorado Suicide Data Dashboard, and I'll show you a picture of that here in just a second. They have these Health Watch reports, and this is up to 108, I think, for this year. So, and most of these are about suicide because that is a big thing in Colorado, especially Boulder County. We are one of the higher counties. And it's a very complex problem. So there's a lot of these papers written on just looking at different aspects of suicide and what information can we gain from these and how can we prevent them. And then there's regional reports. So this here is a picture of the interactive suicide dashboard. So I had selected Boulder County, and I think this range was from 2004 to 2017, and there was, I think, 721 suicides in that time. And so you can play with this on the website and get some different statistics. So it's pretty interesting. So this is a picture of the facility. This was one of the very first things that I worked on when I came into office, is I took a look at what we had. We had just a small little office off of the wing of the Justice Center, and then we were utilizing the basement of the Boulder Community Hospital, and that morgue was just too small for our needs. It was great in the 80s when we started there, but we were at maximum capacity almost every day, and I was having to call mortuaries and say, okay, I need you on standby. I might need to utilize your space if we run out today. So we now have a standalone facility that we do the autopsies, and our entire office works out of the same facility as well. Like I mentioned, we do publicly tours quarterly, so if that's something you're interested in, just give us a call at the office. We can tell you when the next one is. We do like to have a RSVP because they can be quite popular. We staff the office 7 days a week from 6 a.m. to 10 p.m. is our usual hours, and then from 10 p.m. to 6 a.m. we're on call. So we are always available. I guess luckily in Boulder County we have found that we don't have to have someone at the office all night long, so that helps with our staffing during the day. And this is just kind of a preview. A lot of people think that the autopsy suite is a really dark and dungy and mysterious and scary place. But in our new facility, we have great outdoor lighting because we have windows that are very tall, so people can't necessarily see in. They are tinted. We've gone to every measure we can because we don't want somebody sneaking in there with a drone or something like that, but it's, it's great to have the overhead space and the lighting. When you're looking at these injuries and looking for evidence, you need to have the best lighting that you can, and so we've been able to get that in this facility. We have 2 autopsy tables in our main suite, and then this is a picture of our isolation suite, which is a separate room with a separate ventilation system. This room is with the purpose of, say, we thought we were doing a case on maybe a tuberculosis case, then we can kind of quarantine this to one area and not introduce that to our entire staff and our entire facility. So that's just kind of a preview of our facility. If you guys want to come out and take a tour, that'd be great. And I just want to recap that the responsibilities and mission of the office: determine cause and manner of death, like we talked about, make positive identification, notify the next of kin, sign the death certificate, and then answer questions for the families and work on behalf of the decedent. So kind of our long-term planning. Mass fatality planning, both locally and regionally, has been a big focus of ours, especially in the last couple years. We've finally gotten some of the big things out of the way, like the building and a new computer database system. So now we're really focusing on our mass fatality planning, and then also accreditation. So for accreditation, we want to be able to show that we are meeting the 350 national standards that says that we are doing the things that we need to do in our office. So that's something that we're working on currently. And then legacy files. I started a historical committee in the last year. That historical committee is coming in and looking at all of our old documents and helping us determine what's of historical significance and how can we preserve that information. And then my regular staff is looking at most current files. With our new computer system, we're now scanning all of the newer files and moving backwards in time. So our historical committee has started in 1877 is when the coroner's office was put into place in Boulder County. So we have an inquest book from 1877 to 1955. So then in 1955, our paper files started. So that's where the historical committee is starting, is 1955. My current staff started with 2017 because that's when we got our computer system, and now they're working backwards. So someday, 10, 15 years from now, we're going to meet in the middle, and everything will be electronic, and hopefully will be quicker than 10, 15 years, but it seems pretty daunting. And then I always like to end with the Csi Effect. So I don't watch TV. A lot of people find that really hard to believe in my profession because there's so many great shows out there. But I just like to remind, because especially in Boulder, we have so many great educated people that end up on our juries. So they are asking a lot of great questions, but a lot of people watch these TV shows and they think that everything can be done in 30 minutes, DNA in place, all these high technology and chemicals and all kinds of stuff that we don't have the resources for, and quite frankly, we don't actually need on every single case. So just keep that in mind, especially if you are selected to be on a jury at some point, because there's a whole different world behind what you see on TV. And some of the shows are pretty good. Tales of the Morgue, I don't know if anybody in the room has seen the most recent one. One of their episodes that came out for this season did cover one of our Boulder County cases. So if you haven't seen that, look for that. It's Tales of the Morgue. Murder on the Mountain, I think, was the name of the episode. So with that, I'm wondering what questions you guys have. Yes?
What do you mean working for the decedent?
The question is, what do I mean working for the decedent? Well, I guess maybe one of the best ways to explain it is, let's just say that in a smothering case, there may be no evidence of a smothering. That doesn't mean it didn't happen. So this person may have had a natural disease process. They may have been, upwards in their years. They may have been, on a short time frame away from death in the first place, but they're smothered. So if we can go in and find that evidence and know what happened, to me, that would be working on behalf of the decedent. So the question was, or a statement, I guess, was that maybe one of the most difficult pieces would be working with a family especially if we're going to call their loved one's death a suicide. And you are correct. That is one of the most difficult situations we face in Boulder County, and I would say nationwide in any office, because a lot of times the family just doesn't want to take that as what we're going to be able to put down on paper. And a lot of times they may have come to us at the time of the death when we interviewed them, and they give us all kinds of statements, and they believe that at the time to be the truth. But now you fast forward, 4 to 6, 8 weeks when we're final and we have everything put together, and now they're in a place where they don't want to accept that. So it is very difficult. The best way that we can handle it is to sit down with them and to go over all of the information that we have and explain to them why we're looking at it that way and why we're putting it into that category. And I can't say that the family is necessarily going to be happy with that explanation, but that's our job. As for the Colorado Coroners Association, their slogan is the search for the truth. And so we have to put down on paper what we believe is the truth. Yes.
I'm really surprised that there are 9 times as many suicides as homicides in Boulder County. Is that really unusual, or is that normal?
Well, we are very lucky in that we have a low homicide rate in Boulder County. Usually 2 to 8 is how many homicides that we have when you look back over the last 10, 15 years. Suicides has been in that 50 to 60 range for a while, so I would say that is, kind of the norm here, but nationwide we are high. Yes.
Emma, I'm sorry to cut off more questions, but we're very curious about what you do. And thank you so much for your talk today, and thank you even more for your 10 years of service to Boulder County. And in your name, Boulder Rotary is donating 100 doses of polio vaccine in our effort to eradicate polio around the world. Thank you so much.
Thank you.